My name is Dr. Alex Waldman. I'm an orthodontist here in Beverly Hills, and I'd like to officially welcome you. Okay. And that welcome is on behalf of myself and Dr. Simon, who's the co-founder of this study club. And we also are very pleased to welcome you on behalf of Dr. Lloyd Herman, who is Ziv's partner. And of course, Dr. Ari Rosenblatt, Ziv's partner as well. And yes, he's got his own thing going on. So for those of you who don't know, this started about 10 years ago, I think, I'm gonna say, right? Does that sound about right? I think so. We got slowed down a little bit during COVID and, kind of regrouping. I mean, I thought at one point during COVID, like, in-person education would just never come back, huh? It just seemed like too easy to do Zoom. But I think we all realized that there is a really amazing value of being in person together, a certain energy, much better food and wine, for sure, right? And so this is back, and we're so excited that you're all here and taking time out of your weekday evening to be with us, to learn and to dedicate yourself to improving your professional experience and your care of your patients. So that's all I got. And Ziv, do you have any other things for introductions? Okay, so without further ado, so we have more time to learn and more time to eat, I'm passing this over to Dr. Simon.
Okay, thank you all for coming. So excited to see the Dental Hygiene Study Club of Beverly Hills. So thank you on behalf of Alex, Ari, Lloyd, and myself. Today's lecture is about the updates in periodontics. And we feel so grateful that we work with so many great offices out there. We are getting more and more patient referrals. More and more dentists are referring and trusting patients in our care. And we don't take it lightly, because to take care of a patient where the whole almost livelihood and safety and well-being depends on what's happening in their mouth. In our world of periodontics, we try every day to do our best for our patients. And this is why we had a full day, Lloyd, Ari, and myself had a full day of work. 5 o'clock, we change, freshen up, and we do stuff like that. So we're excited about it. Now, periodontics has been around for a long time. It's one of the oldest specialties. I think orthodontics was first. That's one of the first specialties. Yes, and I do remember it. I did my homework. So the periodontist, or the perio practice that was there when you went to school, when we went to residency, I know these things happen. They're very different than how it is today. And this is really the purpose of the presentation today, to update you about the new things that we're doing in the office. So in some ways, you can bring those into your own practices and talk to your patients about the new things, and hopefully this will help a lot. So a lot of the new things in the office, in a modern periodontal office, have to do with technology, new technologies out there. Growth factors, regeneration, and it's not the type of regenerations that we learned in school in the 80s and the 90s, using platelets, et cetera, that Lloyd is going to share with us. So growth factors like PRF, GEM21, Emdogain, these are things that we do every day in the office. And if you went to a perio practice, let's say when Ari started the office in 1981, and you walk into a perio practice today, these are two different worlds. Not that the first one was bad, but we evolved with time. So not just using, let's say, bone grafts, not just bone grafts and sticking them into sockets, we now can create something called sticky bone. So Lloyd will talk about that, mixing bone with growth factors and being able to take bone and mold it and fit it to the patient's needs. And who is benefiting from all of that? The patients. Patients are getting better care, faster care, more predictable care, including myself, because I became a patient, and this is my tooth, okay? So what is this tooth all about? It's a lower second molar that had a vertical root fracture that went from mesial to distal, kind of into the palp. So I bit on something, and it really hurt. So that fracture went all the way into the pulp, cracked the tooth. So I had it pulled and replaced. And I had a very good surgeon, and he gave me a good deal, Dr. Ari Rosenblatt. So besides the fact that Ari has precise and very high-level skills for so many years, we don't only trust the skills, because we can have a bad day. Anybody can have a bad day. Your instrument can slip and cut somebody's gums, right? That happens. It can. So we don't want to have a bad day. So when we place implants, we do them fully guided. So this was my planning. So we plan our implant, and we executed exactly how it's planned. And that gives me a peace of mind as a patient. This was a great experience to be the patient, have a tooth pulled, bone grafting, platelets, have an implant drilled into my jaw. And the whole thing was enjoyable because I had a full, I know it's not masochistic. I had a full peace of mind that my surgeon, my periodontal surgeon, is using guided technology and is delivering the implant precisely how it was planned. Not even a worry in the world. So using technology, the right technology that is scientifically proven helps. For example, this is a technology called Ostel. This is a technology that checks the integration of implants. So because you're working in different offices, you're seeing our reports in the patient's chart. So if in the past we would tell the dentist the implant's fine to go, it's good to go. Now we can put a numerical value. So what is Ostel? The Ostel checks the integration of the implant. So any number over 70 is considered high stability. So how does it work? We connect a small rod to the implant, which is the picture in the middle, and then that technology sends an electromagnetic wave to that rod, to the implant, and that checks the bone level around it. So you're getting a number. You're getting an 80, 81, 82, 71. You can get a 60 as well, depending on the bone. So the periodontist can make a recommendation. You want to load the implant, you don't want to load the implant, wait a few more months, it's ready to go. So that technology is incredible. Okay?
And it's way different than just having a CT scan.
That's different. CT scan is for planning. That actually checks the implant that was in, it's already in the jaw. So in the past, we used to knock on it, we used to twist it. This gives you...
That was it.
That was it. That's what we were taught in school,
Oh, okay.
right? So that's the next level of technology.
How soon after you place it can you do a test?
Okay,
Right away?
so when can we test? So when we place an implant, we immediately do the test and we get the number.
Oh, wow.
Then we test again 2 months later and we see how those numbers fluctuate.
Wow.
And usually they increase with time. And that tells us, hey, this implant is gaining more and more bone around it and it's ready to go. So when the dentist gets the report, it will also say ISQ, implant stability quotient, like the IQ of the implant, okay? And that tells us the implant is good to go, depending on the value. And your dentist knows already about these values, okay? So all these technologies help us tremendously. So if it comes to, let's say, a difficult extraction, okay? This is an extraction. You can see that that broken tooth is very close to the sinus. And when we extract the tooth, all we have is a tiny bit of bone. This patient is a singer, a performing artist. And she doesn't want to have any messing up with the sinuses. And it's kind of tricky to put an implant in there. But if you use technology, you can plan an implant so the implant goes exactly where it's supposed to go. And that's not something that even some of the best surgeons in the world can do. They can't. They think they can. We thought we could before we used the technology. This is way better. So we plan the implant in the most precise place where that triangle is. We plan it away from the sinus, so it doesn't go into the sinus, or we plan what we call a sinus lift. And then that implant can go straight in there. And it's almost counterintuitive. It's almost like a pilot trusting trusting the machinery on the plane, the actual, I'm not saying autopilot, but the instruments. It's instruments flying. So all three of us, Ari, Lloyd, and myself, we also know how to place implants freehand, which is a great skill to have. Sometimes the technology can fail. But instruments obviously give you more predictability, okay? Now this is for one implant. What if we have to place multiple implants? How does that work? Well, the principle is the same. We plan them. We 3D print a surgical guide that's printed in the office. And then, do you see those holes? Those holes allow us to anchor the guide to the patient's jaw so the thing doesn't move. Okay? And then you can get those implants in. And not that we are about speed, but that thing can take about an hour, the whole thing, the whole surgery, about 1 hour, as opposed to 3 hours before. Does everybody know about all on 4, all on 6, all on X, when you extract all the teeth? So a lot of these procedures, we don't have that many patients in Beverly Hills losing all of their teeth. We know that. We know the patient profile. We lose, like myself, we lose one tooth at a time, right? When the tooth breaks. But what happens if you need to pull all the teeth and you need to reduce the bone, you need to cut it down because that's the protocol of all on 4. How do you anchor a guide? How do you anchor? You have to reduce the bone. How do you anchor it? So there's something called stackable guides, from the word stacking, like stacking boxes one on top of the other. So there are 3 guides, and it's kind of cool. You have this guide that fits on the jawbone, on the basal bone, kind of where the chin is. And do you remember what those holes are? Those holes are for anchoring. So we put pins that anchor that guide. And that guide allows us to extract the teeth. These are hopeless teeth, by the way. It allows us to reduce the bone. It gives us a marking where we need to reduce it. Once this step is down, we put guide number 2 that fits on top of it. That's where the word stacking comes from. It's stackable. It goes on top. And then it has those 3 holes. That's where the implants go in. And then once the implants are in, even the teeth fit on the top stack. So they deliver the teeth at the same time. We do this with other dentists. Obviously, we don't do this procedure. We just do the surgery. And then those extensions are being cut off. And the patient is getting the teeth right away if you have multiple implants and they're stable. Okay? So this is how it looks in the mouth. This is how you place the first guide. This is how it is. Then this bone needs to be reduced. So you kind of shave it down or you cut it away, because you need those implants in the basal bone and the deep bone. And then the second guide goes on top, and then the implants go in. And then this is the all-on-4 with the tilted implants. And then later on, once all implants, you can do the same thing for the top. Then the teeth can fit. Now, what is this? This looks like a game to me, like something my kids would play with. Dominoes, right? So these are dominoes, but these are dominoes made for impressions. So this is called taking an impression with a camera. So you connect these dominoes to the implants, and then this is a camera called the iCam. This is photogrammetry. So it's a camera that you pass along the patient's mouth. It looks like that, and it captures the dominoes. And since the dominoes are in different orientations, okay, here's the camera, here's the patient with those dominoes in the mouth. It captures an impression literally in 5 seconds. So there's no impression material. It's not an optical scanner. Everybody knows about optical scanning, right? Most of the offices have opticals. This is not an optical scan. This is a camera that records where those dominoes are and recognizes them. And then based on the orientation, it figures out, okay, these implants are connected at the bottom. And that allows the dentist to get the impression and deliver the teeth right away. Okay, so without technology, this would be a one-day procedure. With the technology, it's maybe 2 hours, maybe 2.5 hours, yeah, and it's so precise. Okay, so those very smart people and those investors and those entrepreneurs that are developing these things are literally benefiting us as a business, but benefiting our patients, where we can afford to offer this type of treatment. So a lot of innovations, but our biggest innovation, okay, I need a drum roll. The biggest innovation is Dr. Lloyd Herman. He's the biggest innovation in our practice. Ari and I have been practicing as partners for 20 years, 21 years. It's been a minute. And these have been great 20 years, but as time goes by, and our practice grows, we wanted to find a great person like Dr. Herman, who, you'll tell us all about yourself. Okay, I'm not going to take this away, but I wanted to share that one of the most important things for Ari and I as periodontists, because we like to stay fit, we like to stay active, we like to stay healthy. And we needed somebody with stamina, somebody that can do the work and keep a smile the whole day and be great, and then collapse at the end of the day. So before we hired Lloyd to join our practice, I took him to the Calabasas stairs. Okay, anybody been there? You've been there? Okay, how many do you do? Up and down? One, okay. Okay, so it's very hard to do even one. So we did like 7, okay?
7?
7 of those, okay. Well,
I need proof. That's impossible.
take my word for it, okay? So, and Lloyd is obviously very fit, and he'll tell you about his philosophy about health. And he's been with us now since February of this year, so it's about 6, 7, 8 months almost. Getting very, very busy the days that he's with us. He has his own approach. Ari has his own personality, his own approach towards patient care, towards the referrals, towards the marketing. I have my own approach, I have my own personality, etc. Lloyd is different, which is great. So we have 3 types of personalities. Skills are the same. Periodontists are very meticulous about what they do, okay? And Lloyd is already an experienced clinician for over 30 years almost, right? In perio 8 years, you'll tell us all about it. We do a lot of education. We have Jeanette here who participated with us in some of our online education. So we're excited to have Lloyd with us to share about more updates, more technology, more growth factors that are being used in the practice, and tell us a little bit about your way to do things. So help me to welcome Dr. Herman.
Well, welcome everybody. I really appreciate being up here, and I know we all have busy schedules, so thank you everybody for carving out some time and being here. It's an honor to speak to you tonight, and I'm grateful for Ziv asking me to be up here and speak, and I'm really grateful to be part of the team. I love working with Ziv, and I love working with Ari and the whole team that we have. It's a professional team, and I feel really honored. So just to give you a little bit information about who I am, because basically I'm new to this community, and just to get people to know a little bit of who I am. I'm from Montreal, Canada. You know, the other side of the border where there's no border wall needed. But what a great place to grow up. It was a beautiful town. Winters were a little long, a little bit cold, but when you look at it from here, it's just an amazing, amazing town. And the winters are a little long. It's a little colder than LA. So I went to McGill University for my undergrad and also my dental school education. And growing up in Montreal, my dream was always to be in Colorado and go skiing and all this. So after I completed my dental degree, I got into the University of Colorado to do a residency. And after I finished my residency, I was actually, when I was doing my residency, I'd go up to Steamboat Springs, which is a little ski town north of Denver. And when I'd go there, I'd always see this office that I'd be like, oh, that would be so cool to work in an office that's like 5 minutes from the ski mountain. Ends up that I meet this guy that was head of the residency for the Children's Hospital. And he says, what are you going to do next year? And I was like, I don't know. I'd love to be in the mountains of, some ski mountain and stuff. He says, why don't you give this guy a call? Ends up, that was his practice, right, that I had been passing all the time. So it was actually just meant to be. So I lived in Steamboat Springs for close to 10 years. And then after that, my mentor was retiring. He had a practice in Aspen, Colorado. And so he was like, would you like to buy my practice? And I was like, great opportunity, because I got to learn about occlusion, full mouth rehabilitation. So, because that's actually how I started. I was, for 20 years in the mountains of Colorado, I was general and cosmetic dentistry. So I wasn't a periodontist my whole career. So I have a lot of knowledge of running an office. I've been general dentist. I've had a whole staff of hygienists. So I really appreciate what hygienists do for our practice, because without you, it's critical. You have a relationship with a patient where you spend an hour and you get to look in their mouth, you get to educate them, and you build a rapport that's really special. So we're grateful for all that you do for us. So just an example of something I did for 20 years. I mean, how great was it? I loved cosmetic dentistry, because you can have somebody where you do some direct bonding like this, and they walk out after an hour, 2 hours, and their whole smile has changed. So when I was, I'd done my, I'd completed, it became like Groundhog Day a little bit after a while. I was just like living in Aspen, and every day I'd go and I'd be able to predict, oh, okay, that person's going to be at that cafe and all that. And I knew that it was time to move on and do something new and reinvent myself. So University of Colorado had a perio program there. And actually, I didn't tell you this at the beginning, but when I first graduated from university and went to Steamboat, I had actually gotten into perio, but I didn't go at that time. So it was kind of a self-fulfilling prophecy that I had to get back and go to perio school. So I attended the University of Colorado, and actually while I was, the funny thing is so while I was while I was doing my while I was doing my perio residency, there was actually a friend of mine who was doing a general practice residency, and so I had linked him up with a friend of mine that was a holistic dentist and all that, and he was doing Ziv's courses, the online courses, the surgical masters, and so he'd always talk about Ziv and all this. So I get to LA, and this implant rep, she was like, oh, why don't you come to the Beverly Hills Study Club today? And so I meet Ziv, and I'm like, we need to take a picture together so that we can send it to my friend Corbin. And so it was just great, because it was like, oh my God, I've been hearing about this guy for so long. And so it was really cool. So, years later, he gives me the test. And I made it, but that, it goes in harmony with the way I live. I like to live life in a way where I'm more holistic. I live life where I look at the end result. Hey, how do I want to feel in life? And I bring that to the way I practice dentistry. So definitely I had a lot of great times living my passion in the mountains of Colorado. And I'm a little bit of an extremist. So one of the things I do have a passion for is flying in a helicopter and having the helicopter drop you off in the middle of nowhere where there's no ski lifts, and you have to know, you have to be able to handle that stuff. But it's exciting. It's an amazing experience. And I do have a passion for travel. And if I'm going to travel somewhere, how great is it when you can actually give back? And this was when I went to the Himalayan mountains, and the great people that I met. It's up in the Himalayan mountains, like northern India. actually near the Dalai Lama's temple, summer temple. And so these are all fruit pickers that live in the mountains, and so they have like, you know, all these different crops, pomegranates and apples and pears, and so you have all these people that can't really get to, or, you know, it's 2-3 hours, 4 hours, because there are these roads. I mean, if you went on these roads, goats are, you know, in the middle of the road sometimes. you can't get through, and I mean, and there's potholes, and so you're up in these mountains. But I mean, the people were so grateful, so it just touches your heart. And then last year I was in Ecuador doing a little work with Full Smile Foundation. So it definitely fills your soul with some, you know, heart. And definitely in my travels, this is Machu Picchu, and I got to incorporate a little bit of yoga into your adventure there. I ended up hiking it up, and it was such a great adventure. Actually, I have a funny story at the end of my little adventure, going around the whole village and all these relics and stuff. So I had just come from the U.S. at that time, and I had a Whole Foods bag, and so I had all these snacks that I brought on the plane. So I pulled that out of my backpack, and these Americans came over. Where'd you get Whole Foods from? And I was like, you don't know there's one down in the village. So it was kind of funny. And one of my passions is when I was in Aspen, a friend of mine got me into tango dancing, and so I've spent a lot of time down in Buenos Aires. That's my one of my tango teachers that got to spend time down there, and it's actually a really great dance. It's taken a lot of years to learn. And if anybody knows horses are definitely an animal that's a little skittish. They're if you don't have the right energy with them, they're not going to respect you. They feel energy. And so I've ridden horses for a long time. I haven't done it enough recently, but it gives me a good way to interface with patients, because you have to keep your energy stable and calm and all that. And so I do deal with a lot of phobic patients and everything, and not that we all don't, but it's a matter of that has helped me to kind of get to that place of calm. And these are my babies. Yeah, this is my family. They're a little furry, but you know, yeah, this is when I come home at you know, the end of the night, like tonight, it'll be like they're gonna go wild. Like they give me hugs and kisses and stuff. They're the best. And so where I live right now is in Calabasas, which is more, the reason I live there is it has more nature to it. I get, at the end of my street, there's a great hike, and the top of Topanga and all that. And actually the bonus thing is that Ziv lives close by, so we get to carpool in the morning. And so, you know, this morning we were actually, he was coaching me, just giving me a little, you know, rundown of, hey, you can put in these little things. And so we were running through that, and so it's great to be able to do that. So moving on to what we're here to learn a little bit is, you know, what is the periodontist role, the hygienist role. I think we are very instrumental in helping patients to, you know, learn stuff to keep their health up, and so it's really crucial. And so we're looking to keep a healthy and functional mouth, right? So if you have infection, you have pain, patients are not going to be functioning well in life. So, you know, our goal is to keep patients healthy. And, you know, even you sometimes don't think about this, but by identifying, let's say, a certain lesion, we can save someone's life. You know, if they have cancer, if we identify it early enough, we are helping someone live longer, saves their life. So that brings me into the next part of what we're going to discuss here is just looking at examples of different things that we might see in the mouth, and maybe sometimes we don't even think that it's anything, and so sometimes we need to be aware of the little things that are there that we overlook or somebody else like, I mean, first of all, if the dentist is doing a quick exam, they don't always have the time to see this. So we rely so much on our hygienists to look around carefully and point out, hey, look over there. And I know how many times where my hygienist, I would have never seen it. And they just say, hey, look at this. And then I'm just like, oh, wow, okay, yeah, we need to do something. So another example of a squamous cell carcinoma, and this is a little small lesion. You might just think, okay, periimplantitis, and it looks maybe like an infection, and then when it was removed and biopsied, it ends up being a squamous cell carcinoma. So this is something that's critical to catch early. I mean, this patient, they did have like part of their jaw resected and everything, but they're still alive. So one of the tools that we do have in our office is the Velscope. Does anybody use that here?
What is it?
The Velscope. Does anybody around here use it? Yeah. Okay. So you're familiar. Yeah. So basically, this is a device that sends out light and helps you to identify areas that may not be healthy, and so it gives you a secondary tool, like, hey, should we biopsy this? That looks a little weird. We should probably biopsy that. So this is showing you a little bit of the way it works. It sends out a blue light, and then it helps to see different wavelengths. So this is an example of geographic tongue, how it would respond to those wavelengths. Here's a leukoplakia. Here's a suspicious lesion. So these tools just help us to further diagnose, and so we have a little more confidence. Hey, yeah, that needs to be biopsied. And in going into our next section here, I mean, you think about what are we really dealing with? Our whole scope of everything is microorganisms, right? So when you analyze, actually, we are superorganisms. We're 10% mammalian cells and 90% microbes. Think about that. So inside your mouth, there's bacteria, viruses, fungi. So the bacteria can appear at the gingival margins. It can appear up in the gum tissue. Here's an example of just the immune response of what you can see as a result of bacterial infection. You have fungi, viruses. It can appear in the attached gingiva. It can appear on the lip, more for a herpes virus. And good news, they all live in harmony. So how can we tell the different bacteria that are in the mouth, and let's say how we actually treat it? So we can have a patient rinse and spit into this sample, and we can analyze what type of bacteria are in there. This is a sample report, and you can see that the high risk of pathology is present there. So this helps us to know, hey, is this a patient that can benefit from an antibiotic? So some of these stubborn perio cases might need to have an antibiotic every 2 years to help kill the resistant bacteria. So fungi are opportunistic. You can have. Also, one of the things that I think that people probably don't do enough of is tongue scraping. That's something that you know, you can see on this tongue, look at how dark that is. I think if they did tongue scraping regularly, it would make it a lot better. And you can see a lesion down there, some candida. So just a test if you wanted to test for candida. So viruses are a little trickier. Basically, you can have them forming, the HPV forming at the gingival margin, and you know, it looks more cauliflower-like. It's not looking regular. I mean, how many people have seen HPV viruses or HPV lesions, right? I mean, they're kind of distinct. You can tell. You can tell that something's not right. So I mean, look at the way that's just appearing on that gingiva. So how do we treat this, right? We want to remove it ASAP because some of these viral lesions are related to throat cancer. So basically, HPV causes 60 to 70% of the throat cancers. And so there's different strains. So if we know which strain it is, we see the propensity to what is the higher risk. So we remove it. I mean, that would be more of an ENT. That would be a hard one to get off there. And then on the tongue, just on the gingival margin, easy to miss. And so one of the risk one is 27. Also 16 is one of the big risk ones. So how do we deal with this? Like, how do you present this to the patient? How do you then take it off? And then what is the recurrence? So basically, you might refer it to an otolaryngologist. And I haven't even had any wine yet. Exactly, that's what but I wanted to make, you know, a little bit of, I wanted Ziv to be able to pronounce it. So you want to do thorough screens every few months, and you can retest the saliva for HPV. So one of the things that we're asked is HPV an STD? So in a way, you can kind of consider it that way because it is transmittable, but it isn't necessarily just transmittable, you know, as an STD. You could get it from maybe sharing something. So that's a little different category. Here's an example, and they can come back. So what is a way to treat it where you can have it more likely to be totally eradicated? So, pardon? That's where we're going. So why do they come back? Because basically they live in the tissue. So, you know, you might remove a little piece of tissue where it is, but it could be residing a little further away from that area. So how do we get rid of it? Now we're incorporating removal along with laser treatment. So that laser light can penetrate the tissue, affect the virus, and kill that a lot more successfully.
I have a question. I'm sorry.
Yeah, no problem.
How do you go about telling the patient you have like this going on and we need to laser it out?
What do you mean by, no, well, we surgically will remove it.
No. Like, how do you go about telling the patient? Like, I see this lesion, it's like a virus. Oh, like, how do you go about telling the patient without making them feel bad?
Oh, well, sorry?
The verbal skills.
Yeah. Okay, so I get it.
Because I've seen that numerous times, and I just don't know how to, like, go about it.
So what has your experience been?
I'm like, listen, there's a little lesion here. We need to monitor it. When you come back in 3 months, I'll check it again. It's still there. Like, literally, I had a patient last week. A young lady, super nice. So it's the same thing. And I told her, listen, next time I need to laser this. And that was it.
So are we talking about
Okay, she didn't say anything.
it'll be biopsied?
No, I didn't say anything about biopsy.
Okay.
I said, listen, we might need to laser this. I'll have the doctor look at it. It might be like herpetic or something going on.
Yeah, so that's a great question. So first of all, I mean, one of the things that is probably a good marker is, first of all, you might tell the patient, hey, let's have you back in a few weeks to see if this heals. I mean,
I monitored it from the last like 5 to 6 months. It was the same measurement.
yeah.
And I documented it. And it was the same when I saw her last week. Nothing grew.
Yeah, no, so I think that the danger of leaving it too long is that it can, first of all, could spread to other places. It could spread, let's say they're having intimate contact with someone that could spread to that person. So it's probably better to make someone a little bit nervous so that they are encouraged to have it dealt with quickly, rather than, oh, let's just wait and watch.
Nothing changed. It was good.
But it's still the virus. It could be spread. If it's the strains that are propensity towards throat cancer, the longer you leave it in there, the more it could spread, and actually they have a risk. So you're doing a service by making them a little nervous in a way, like, so I totally understand where you're coming from, because you're trying to nurture the patient, but at the same time there is the urgency sometimes to get things, if it's let's say a lesion that is a herpetic and you see like an open wound and stuff, yeah, you wait 2-3 weeks, let's see if it heals. Maybe put them on an antiviral or something. If it heals, then they're all good. But if it's cauliflower looking and it's raised and all that, then it's probably better to. And if you're not feeling comfortable, we can help you out, and you could say, hey, you know what? I'm not sure, but we can send you to the specialist. They have some other tools that they can use to analyze that and give you a better idea of what needs to be done. So it takes it out of your hands, and kind of you're not the bad person, and exactly. So we'll be the bad people. But I think that's very difficult, because you have that rapport with a person, and you don't want to scare. You're trying not to scare them, but I think by referring them, it probably makes it easier for you. Yeah. So this was our team at the. Oh, sorry. Yes. Yeah.
Like they want them to do it in dental offices, and everybody should do this. Is there less, do you think, of this HPV in the younger population?
So your question is that with younger kids that are getting the vaccine, are we seeing less HPV in circulation? So I don't know. What do you?
There's tons of it. We see this all the time. We see it more than ever.
Yeah, I'm not.
Different HPV. Let's go for the vaginal HPV.
Yeah.
That way it's a short amount of time. It's in a week.
Yeah. Yeah. So no, I mean that's what. So basically, just because it's hard to hear you and the whole crowd, but basically what we were saying is, in a 2-week period, maybe you get them back. So it's not like you're leaving it months, and so you're keeping an eye on them. You're making sure it's not a lesion that's just going to go away, like a herpes lesion. But these lesions are important to biopsy, because once you get to 16 to 27, those are all high risk and you don't know how fast it spreads. We look at, why is it spreading? Maybe somebody gets really stressed. When your immune system goes down, that's when things spread. So you don't know, they might be under stress. So the sooner the better. So there are many lasers out there. The one that we are using is the Nd:YAG erbium. So there's, CO2, that's not really one that a lot of people use, especially in dentistry. The diode, a lot of hygiene offices or hygienists will use the diode. And then there's the periolase, which is, the LANAP type of protocol. So the reason we chose the Nd:YAG erbium is because it actually has two different laser systems in it. It's basically going to be a few different wavelengths. So one of the wavelengths is, you have your erbium YAG, which has a mid-infrared, it's technical stuff. I don't think that we need to go into that, but how does the laser really work? It's going to be attracted to certain types of materials. So it's using a focused beam of light. The energy is sent to the tissue. It treats the tissue, and so what we're going to get is cutting, reshaping, cleaning, removing calculus. So the erbium YAG type of laser will be more of the cutting, reshaping, cleaning calculus. The Nd:YAG, which is the one that they use for just the LANAP, that will kill the bacteria in the tissue. So with our laser, the Photona, it actually can do both. So you can treat them where you do a protocol where you're first of all killing the bacteria, then you're cleaning the roots, you're detoxifying the roots, you do some other, you do scaling root planing, and then you treat it with the Nd:YAG again, so you're forming a blood clot there. One of the things actually that I think is really important is we need to look at the occlusion also. That's something where in a protocol you're wanting to always look at the bite. You're looking at recession areas sometimes, and you're like, oh, why is that happening? There's so many different things. Is it toothbrushing? Is it occlusion? So in order to get new tissue to form or to reduce pockets, we need to have healing and regeneration. So again, I went into that. So it's two lasers in one. So it's the Nd:YAG erbium. There are different types of, on the periodic table. They have different wavelengths. Or they create different wavelengths. So how do we treat the periodontal disease with it? So, again, kind of the protocol that I went through. You go down in the pocket, you clean it out, you form a blood clot, and hopefully, if everything is, patients taking care, they're doing their home care properly, and the tissue is right for healing, we'll get regeneration of the tissue to the tooth. So this is an example of an area that Dr. Simon had seen before the laser was in the office, and treated it and tried scaling it, and nothing really was improving. And so this was something that we just treated recently with the laser, and look at the difference of what's going on there. It's so much better. So it's amazing what the laser, just a little bit of light that, that's all I did was just run the laser over there a few different ways, but it made a big difference. So you can see the before and after. Look at how amazing that is. So, we can treat with the laser, we can treat the infected implants. The different wavelengths have different ways to treat it. Basically, the erbium will explode water. It cuts, but also explodes water, so those water molecules will get onto the implant, explode, and push off the plaque and bacteria, because really they're rough surfaces. So how do you how do you get that clean? So that water is safe on the implant. It doesn't burn it, doesn't heat it, and it helps to clean it off. So this is, you can see the implant surface being disinfected, and then we can bone graft it. Close it up, and amazingly our body can heal. So how much are we tapping into in our body of healing? I mean, it's a minuscule amount. So, you know, we actually have these amazing built-in remedies into our bodies. So we have immune cells which act like antibiotics. We have cortisol, which is an anti-inflammatory. We have dopamine, serotonin, which acts as an antidepressant. And our skeleton acts as a source of calcium. And even our cells produce peroxide, which helps to kill stuff. So, you know, we can regenerate. And you can see, you know, this lesion right here, it was forming a perio pocket, and you can see the bone grafting helped to regenerate that area. So how can we tap into this potential? PRF is one of the ways that we use in our practice. Basically, you draw some blood, spin it in a centrifuge, and you know, you get these membranes that form on the top, and it gets, basically it's getting rid of the red blood cells which don't help in healing, and it gets the platelets and healing factors, so concentrates them. And so this is just an example of a setup, and you can see those membranes forming on there, and this is an example of a PRF membrane. And what it really helps us with is when we're bone grafting. So it forms a form of bone where actually the particles stick together, which is very, very helpful. You can see that you can actually pick it up and lift it up, the whole piece of sticky bone. And so we actually process liquid. We can inject the liquid around, let's say, a tooth that we just treated, helps with healing, and then it's mixed with bone graft, and we have membranes so that if we have a surgical site, they actually used to use this on diabetic patients to help them heal, and it's really effective. So you have PRF with bone and soft tissue, so we can combine all these things. So we use it in gum procedures, extractions, bone grafting, sinus procedures, and recession treatment. So how do we use PRF? This is, I think, a little bit more than you guys always get to see, but here's a little rundown of what we do. So basically we condense the bone in, we'll cover it with PRF plugs, and then we'll suture it over. And then amazingly, it heals up to ideal. So we use it in soft tissue grafting, injecting it underneath the, where we just put in the grafting material. And, you know, there's bone grafting. So this area, look at this tooth that is badly infected. So this is the extraction socket. And really, why do we recommend bone grafting for an extraction? Why can't you just put PRF in there and just let it heal? So studies have shown that if you don't bone graft an area, you'll lose about 50% of the volume. So it actually really helps the patient avoid having to have extra grafting in the end, you know, when they're ready to get their implant. So here we are, just again, the way we bone graft in, look at the way it heals. And then it's ready for an implant, and we have a great site. So what does it do, PRF? So it stimulates tissue regeneration, it enhances wound healing, it reduces inflammation, and it helps improve bone regeneration, along with, you know, reducing the risk of infection. So more and more we're seeing holistic patients. I don't know how many of you find that you see a lot of people that want more natural stuff. They want to. Yeah. So I mean that's actually.
Like they treat themselves, everybody comes in.
Exactly. So what are some examples of things that they do that?
They don't want metal, they don't want fluoride, they don't want any deep cleaning, they don't want any fillings. I don't know what they want.
Okay.
Tell me what you want me to do, I'll do whatever you want me to do.
So yeah, no,
What do you want?
I deal with a lot, and you know I do a lot of zirconia implants, and that's what people are wanting to get away from the metal, and you know there's advantages and disadvantages of each. So you know whether or not, but definitely I believe in when we have dissimilar metals in our mouth that can affect our body, and mercury fillings are no, I mean, you know really there's no place for that anymore in our lives. So there's 3 types of holistic patients. Did you know that?
No.
So there's the health person, which I don't know if those are the Encino ones, right?
I swear to God,
There's-
I think there's like the worst patient possible.
They can be a little taxing.
Like, what now? Everything is like, okay.
Between Beverly Hills patients and Encino
So then another type is, you know, the ill person who actually really does have like some conditions like Lyme's disease and everything. Then there's the woo-woo, which may be a little bit of the Encino patient that you're talking about. They kind of, okay, well, let's do the pendulum today. No fluoride today. So what are they looking for in their dentists and hygienists? So, you know, we're looking at understanding biologic concepts. So you have to negotiate with those patients a little more and have some good, you know, research to back up stuff that you're doing. So understand different health systems, have a little more knowledge of integrative medicine. I think the conventional medical system is like, okay, we go once a year, get a blood test, and then all of a sudden, oh, you're fine. You know, what do those numbers mean? What is our health like? They're not really coaching us to wellness. They're kind of coaching us to just survive. And so, you know, you get sick, and then all of a sudden, oh, okay, you're sick. Understanding how to detoxify our bodies. Understanding, you know, what we put into our body is like pesticides and all that can poison us. Understanding materials that we use, are they compatible with people, and do they have allergies? And understanding nutritional concepts, supportive therapy, and safe protocols. Like if you're removing, let's say, amalgams, are you doing it in a safe way? And you know, really being able to understand that and explain it to those patients. So, you know, it goes hand in hand with holistic patients. We do use ozone in our office. Patients really love that, and it's a very helpful tool because it is a natural occurring gas, and you know, we have it in our atmosphere, and we're a little bit concerned, like, are we opening up this big hole? But it actually can be very helpful and useful in our practice. So what is the difference? It's just 3 oxygen molecules all put together. And it's very reactive, so that's why it can kill things. So what does it do? Kills bacteria, kills viruses, kills fungi. So, and it also stimulates the body to do its natural healing. These are some of the benefits of ozone therapy, you know, antioxidant, anti-inflammatory, helps with aging, helps, you know, boost the immune system, and just overall it has very good effects with little consequences. Is it enough for what?
Somebody has an infection, but they ask us.
Well, it's used more in conjunction. So you still have to get rid of the infected tissue. Like you still have to curette all the infected bone out and use maybe a piezo to clean that out, use the laser to disinfect it, and then the ozone's another tool that helps to ensure. No, but it does. I've seen infections go away. I've injected into the tissue, and it actually. No. You have to analyze what. Well, you have to make sure that you've gotten rid of the source of the infection. Yeah. But it helps to sterilize the area, so you get rid of stuff. Oh, it's actually a tooth that is just infected. Yeah. For sure. Yeah. Yeah, no, I mean, I'm not saying that ozone solves all the problems, but it's a tool that we use to help to. Exactly. You have to evaluate all the.
And she's okay with like letting it drag on. I've been waiting for it right now.
Yeah.
That makes it very nervous.
Yeah.
She will not take antibiotics. It's 3 years. I so she's sort of lives her life that way.
Totally, but it's a tool in our toolbox.
How do you present it? When do you present it?
Ozone? We're not really offering it as an extra service. It's incorporated in what we do. So we're not actually necessarily selling it to them. We're actually just allowing or using it as a tool to help in having a successful process.
Tissue, inflammation, infection, when do you use it?
Great question. So basically, when do we use the ozone? We'll use it for any type of infection that we find. It's good for an extraction socket because you don't know what happens. I don't have a picture. There's a little cannula for the ozone gas. There's different ways you can use it. You can use it ozone water, ozone gas. This is a ozone gas machine, and basically it has a little tip, like one of the a little tip, a cannula that's not sharp, but you can put it in the socket and use it in that way. Does that make sense? Any other question? Yeah, we're using it, but I mean, you could. I don't know if there's any rules against a hygienist using it.
We do it.
Yeah, you want to get trained, but I don't think there's any rules for hygienists not to be able to use it. I don't know of any. Yeah.
Actual guy who registers everybody came to our office like 3 years ago. So he demonstrated, he registered all of us, we all use it.
Yeah. So that's it's very helpful. And also patients love it. They the holistic patients will.
It's like spa treatment.
Yeah.
Smells like the pool.
Exactly. It's a good way.
In the pool.
Yes, exactly. So we had already answered this question.
It's chlorine.
Yeah, so we're disinfecting extractions, we're stimulating bone growth, enhancing healing. Sometimes even when we do an extraction and the socket's not bleeding, we want it to bleed because that will help it to heal. So ozone can help to create an environment where there's more blood flowing in that area. So So here's an infected socket, you know, just showing the examples. This is the machine, put it into the socket, then we bone graft it, use the PRF again, and we have healing. So there's other ways to use it. You can actually put it in an IV, and I've had that actually done to me, and it actually will help you. Like I've had IVs where I was feeling like I was getting a cold, and I had the IV with vitamin C, vitamin B12, and a few other, like a Myers cocktail, and some ozone injected. The next day I felt fine. So it really is an effective tool, and it's underutilized.
But you can use taking conjunction.
Yeah, with all our healing, yeah.
Would you have that done?
Pardon?
Would you have that done?
Where did I have it done? Many places. I have actually a supply for myself of all those drugs. So I'll, no, I can't, but I'll have a nurse do it for me, or my anesthesiologist or whatever, you know, if I'm have a case, so I'm like, could you stick me?
So
Right?
if you're feeling old one day, you get that, and the next day you feel like you're young again?
Even that day.
So did you do it?
He doesn't, he's like the Energizer Bunny. He doesn't even need it. He doesn't sit still that long.
I actually had the guy, I have a lot of TMJ issues, so he injected in my TMJ. I was so sarcastic, but it really helped. Like,
The ozone.
yes. I was like, dude, that's not gonna work, this is bullshit. Like, a couple of weeks later, I was like, no, my TMJ
Yeah.
is like really good. I was just telling her. And I was like, I was so skeptical about it, but it really works.
Well, it helps to reduce inflammation and helps in healing.
For sure it helps.
Yeah.
I don't know.
Well, that's great. No, that's a great example. So this is, you know, we can use IV therapies, and this Myers cocktail is something that I would recommend to everybody. If you're not feeling, sorry, it's actually magnesium, calcium, B1, B2, 3, 5, 6, 12, and it has vitamin C, and it also has glutathione. So that helps to support your liver.
Question about the ozone. A lot of my patients ask me about oil pulling.
Yeah.
I don't think it works, but then they started asking me about ozonated oil.
Yes.
Oh, yeah,
Do
we
you
have
think that would make a difference because they think they can treat incipients with ozonated oil.
Sorry, they can treat.
They treat incipients with
Oh, incipient lesions. Yeah.
incipient lesions or caries
Yeah.
with ozonated oil. So is that something that you would recommend?
I think that it's something to try out on a patient and see how they respond. It's just like anything. I mean, sometimes you do your best treatment and the patient doesn't respond like you expected. And so I had a very interesting case recently, which was actually a person that I work with. And I took out a tooth it was a big infection, but it should have healed fine. And she got a dry socket and all this stuff. And I'm just like, I'm feeling terrible because, you know, I know her well and all this. And after a few weeks, we had her take some blood tests, and it ended up she was low on everything, like all her B vitamins and all this. So you sometimes have to look a little deeper, you know, because I know there's times where you have a patient where they're not responding, and it's like going a little deeper is important because that's kind of where I look at my holistic aspect, because I look, hey, why am I not feeling well? And sometimes after I get something like this, I'm like, oh wow, I'm revitalized. Or was I too stressed at a time? I think we underestimate how stress affects our bodies. I know I went through a very stressful time, and I started getting some recession of my gums. And I was like, I've had patients, I mean, how many of you have heard patients tell you, oh yeah, I was really stressed at that time and I got some recession and now it's been fine, right? I'm sure some of you have heard that, right? And I never used to believe it until I went through that, and I was just like, wow, stress can really affect the way our body works. So these are all things that you have to take into account. I think that's where I bring in a holistic approach, because I'm not just saying, hey, every patient should heal the same way. Every patient is unique. You need to look at what is their constitution and their body. Are they healthy? And hopefully direct them maybe to a practitioner that's not just a regular medicine practitioner, because I think a lot of the newer practitioners that are more in the holistic health, they can sometimes do some tests that help you look at your methylation of certain, and also they can look at more things, in your body composition, and then get to literally the root of the problem, right? So, yeah, exactly. No pun intended. So, how do you improve your health? So, remember, take your meds. Mind meditation. That's what I was just talking about. Stress. How do you release your stress? Exercise is important. Why is exercise important? Our blood has to flow through our body. It needs to go to places where you don't have as much oxygen, and get those areas cleaned out. Your diet. Diet is so important. I mean, we're so lucky to have this food tonight. And then sleep. And that's one of the aspects that also I'm even looking at my sleep pattern, like doing a little sleep apnea testing and all that. I think that these are all factors that we underestimate. And if you don't sleep enough, why are your gums in bad shape? And we've done everything. That could be a risk factor. So, without ado, this is the next part of our talk. Ari, he is going to talk to us about the vitamins and nutrients that help us to stay healthy.
Our hygiene staff that sits here in the back, that Stacy couldn't be here because she is still driving after 40 years for 2.5 hours to the office, coming and going. But she has been over 40 years, and we have somebody here who's been 30 years and 20 years. And again, thank you to all of you. Without you, we couldn't do our good work, and we appreciate it very, very much. So the good news is I'm the last speaker, and there's no bad news because my part is going to be very short. So I appreciate you giving just another 10, 12 minutes attention to us, because I'm very passionate about how we take care of ourselves and recommend our patients to take care of themselves. What you heard about up to now is all the new regimens that we can apply and ask the patient to participate, but it's mostly about us doing the work. And I always believe that you need to have a responsible relationship with the patients, and they need to do something, and we need to do something in a relationship with our doctors. So we need to take care of ourselves. So whatever I'm preaching to you is something that I do myself. Everybody's laughing. I'm carrying those little things that I do myself, and I used to believe that supplements are very, very important, but it was really a belief system without too much scientific evidence. And what has happened now in the last 2-3 years, especially coming from Europe, and we have one colleague who introduced us many years ago to the PRF and encouraged the healing, and he and some cohorts in Europe really have done some scientific research to see what supplements are actually doing for our health. Forward. So basically, just reviewing, we know that we are responsible for suture techniques and gum thickness and all the biologic things, but in that puzzle is the immunity and supplements that now it's not anymore a belief system, but has been scientifically backed up and proven that it's very important. I'm going back to the previous lectures 4 or 5 years ago when COVID started. We gave lectures on Zoom because everybody wanted to try to protect themselves. And we came up with all those things that we think helped us in the office to keep us healthy. There are more than a few people, including me, who never got COVID. And again, it's maybe genetic or whatever, but I was religious following all of it. And now, luckily, this is all the past. But starting with medicine, I personally have the genetics that cholesterol is a problem or whatever, and everybody knows it's important to control cholesterol or whatever. But now there is scientific evidence that anybody who has a cholesterol level that is not ideal, and we know about the HDL, that is the good cholesterol, the antioxidant, and the LDL, that is an oxidant that disturbs and delays good healing. And there is now scientific evidence that anybody who has a higher LDL, and they can actually quantify it in numbers, and we didn't want to bore you with the references, but I have all the scientific references for it, that if somebody has an LDL that is elevated in a certain number, the osseous integration and the healing will be delayed. And if the numbers are even higher, we are wondering on some patients why we place the best implant, do the surgery, and it doesn't heal. And now we have scientific evidence. So this is, I think, our object and our desire to educate the patients. Plus, I think it's important for us to know this. So getting into supplements and vitamins, everybody knows that vitamin D is important, and most of us lack it because we're not supposed to be too long in the sun or whatever. But I did not know a few years ago that when you take vitamin D, that it's only 60% effective if you don't combine it with K2. So now you can buy, and all the slides that we show you are generic vitamins, don't look at them or whatever. If anybody wants to ask me, since unfortunately I'm really very retentive about this, so I can tell you which companies I think are good supplement companies. But basically be aware for yourself and for the patient's health. Healing will be delayed if your vitamin D level is below a certain number, and it has to be combined with K2. Everybody knows vitamin C is important, but again, we know now that it's not only important for so many other reasons in health, but it's a powerful antioxidant, and it improves the connective tissue healing, it reduces inflammation, and we have now scientific evidence with implants that it actually increases the osseointegration and reduces the numbers of the bad LDL. Now, I personally, like some people, have fallen asleep or whatever and got educated myself, as Lloyd said, about meditation or whatever, and got away from all the sleep medication or whatever. But I got used to taking melatonin every night, 2 milligrams. Now, maybe that is just a powerful thinking that may help you or whatever, but it helps me. But I have to tell you, I was clueless and wasn't aware until I read the scientific evidence that besides supposedly making it easier to control your cardiac rhythm, that it is a very powerful antimicrobial and actually a strong anti-inflammatory. So again, for the people in the club who have problems falling asleep, and for patients now who want to increase their health potential, I think it's very important to think about something like this. Now, I will share that privately for you. But basically, it's no secret. I love the company. It's called Pure Encapsulation, and I'll share the lead for you because they are one of the companies that are producing everything here and not abroad, so the control is better and everything is supposedly cleaner. So I'm sharing all of it for you, and I'm taking a little bit the thunder away because this is not only for me a new education, and I want to share it with you, but basically I'm sharing this because everything I'm telling you, and I'll show this in the end, we are beginning now, as Lloyd said, there are some people who are, no matter what, they're going to heal well, even if your surgery was done in the most worst way because you didn't sleep well or whatever. And there are some patients who need help with healing. We are beginning to recommend, and you'll see this at the end, everything I'm mentioning you we are putting in a package, and again, we can't force the patient, but we tell the patient all the new methods, ozone, if you believe in it or not, PRF and bone grafting or whatever, but the patients are asking us, what can we do to improve the result? And now we are giving them something that's not only a belief, but it's actually scientifically proven. And basically we are telling the patient, if you are doing a surgery, any surgery in a hospital and now with us surgery, you need to get your body ready for it. And now we are giving them something concrete to put them in a better position. So I'm just reviewing, and I'm not going through everything, but those are supplements. And I can share this with you privately, or you can take pictures of it, but there are now scientific proof, medical proof, that a lot of our elderly population are deficient, especially in zinc, that it is very important, for example, after extraction, and promotes bone formation and decreases inflammatory processes. So it's something for us to be aware. Patients are asking us about probiotics. Again, there is not so much research about it, but it's beginning to show. And I feel like, and I'm sharing just personally with you, I have not read anything about probiotics that they're bad or that they're doing any harm. And now we are beginning to see that they're actually, and we know everything is today the buzzwords, inflammation, chronic inflammation, and the gut function. So we know when our gut functions well, our immune system functions also better. So we definitely recommend before and after surgery to take any kind of probiotics, and there are many different kind of forms. I want to share this with you just personally because we are an intimate group. I carry my supplements, my little plastic things for the morning and the evenings or whatever. And I have a brother, my only brother, who is younger than me and much smarter. He is a brain surgeon in Chicago. And when he saw all the vitamins that I had taken in supplements, he started to laugh and literally ridiculed me. And my response was, yeah, but they're all natural. What can it hurt? And his response was, arsenic is also natural. It's a very cynical response or whatever. The only problem is that my brother is younger than me and has at least 3 times the year the flu. And knock on wood, Ziv, you know me, 44 years I hadn't had one sick day. So I do believe in this, and the nice thing about all this new research now showing that it's not anymore a belief system, but it's scientifically also proven. So obviously everybody knows about vitamin E. We know about copper and magnesium, especially at night to prevent cramps and everything else. And the omega, I'm going through normal stuff. What was very surprising for me is to find out in Europe, unfortunately a lot of research is being done more in Europe than in the United States. Dr. Otashami actually got the Nobel Prize for the fasting program. And you know, some people believe or not believe in it, but besides feeling good and besides maybe losing a few pounds, there is now scientific evidence that the fasting has actually a physiological detox effect. And basically, no matter how you do it, they have now independent studies showing that your healing will be faster and improved if you do it 5 days before and 5 days after surgery. Ziv and me do this once a week to begin with, but there's scientific evidence, and this is intermittent fasting, meaning no food for 16 hours, not fasting like us Jews on Yom Kippur or whatever. So once you get used to it, I have to tell you again, this is just, it makes you feel actually good. But now there's scientific evidence, 5 days before surgery, 5 days after surgery, it is beneficial. So the summary of it is that our colleague that shared all this new information for us, who happens to be in France, is not only an amazing scientist and a great lecturer, but he's also a very smart businessman. And he put together a pill box where everything I told you about is in one pill. I was very, very, very surprised that being a very fervent Amazon fanatics, there is not one pill that everything what you see there is available for sale. So I called them and I said, we are buying 100 of them for our patients. This is so successful in Europe that the product is 6 months back ordered. It's amazing. So apparently people believe in it and people are using it. So if you can't buy it in Europe, basically you can put all different kind of products together. You can take a picture of it, I can show it for you. But basically, instead of taking one pill, you are taking 9 bottles and you get that. But again, you have now scientific proof for yourself to stay healthy and for patients to improve the outcome of surgery. So this is actually my kitchen counter. So you don't have to go overboard to do what I'm doing, but I wanted to just share this stuff with you. I'm the last speaker. I wanted to keep it a little bit light. I want to thank all of you on behalf of Dr. Simon and Lloyd and the whole Hygiene team. We appreciate you wanting to learn, and we hope we provided you with a comfortable setting here. Thank you, Ziv.